Hello, I'm here with Dr. Ken Winters from the University of Minnesota. He's a professor in the psychiatry department and the director of the Center for Adolescent Substance Abuse Research. So today he's going to be talking to us a little bit about adolescent substance use. So the first question I have is, if a caregiver was concerned about their child, how could they find out if their child had a substance use problem?
It's a great question because a lot of parents are probably not going to do a very good job or have the opportunity to do a very good job of figuring out if their youngster is using drugs or having a problem. As one can imagine, drug use is a relatively secret event, private event, and even in a home, even with parents watching over their teenagers as best they can, a lot of times these kinds of problems are going to go undetected. But I tell parents, one big thing that often happens when a youngster started to drift into drugs is that there's significant changes in what they see in the teenager's behavior, attitude, and emotions. So I don't mean the typical teenage thing about, well, they don't want to hang around parents as much as they once wanted to. That's typical for an adolescent. That wouldn't be a sign of much. But is there a major change in the types of friends that the youngster's hanging around that are very different from who they used to affiliate with? Is there a significant difference in how they're viewing school than in prior years? Do they notice any sleep changes that are very radical? I don't mean wanting to sleep in on Saturday morning, that's typical, but able to stay up long hours at night, and then maybe even able to get up early on 3 hours of sleep and look like pretty soon they're able to be, very alert. That would suggest somebody's using medication or drugs to help them through that kind of problem. So look for major changes. Also, best as possible, monitor, the youngster's whereabouts. If you think there's drugs or paraphernalia in the house, at least you should have a discussion with the teenager about those concerns, and tell the youngster that if concerns continue, you might have to feel necessary to do some inspecting, to look through the room, because some teenagers think that perhaps there's a lot of privacy in their lives, but in some homes, I'm not sure you want to have 100% privacy in the teenager's personal space and their whereabouts.
And if a parent was concerned, where would they go to seek help or some sort of assessment services?
I think nowadays in America, most mental health professionals have training assessing and screening for drug use problems. So the key would be somebody who's good at dealing with adolescent or child behavioral problems. And a lot of community mental health centers or local clinics are going to have professionals with that skill. Now, a lot of alcohol and drug treatment programs also have screening or assessment services, and so in many instances that can be also a very valid place to turn to.
Okay. And what treatments have good scientific support for adolescent substance use problems?
One of the things I remind parents is that luckily we know a lot more about what works and what doesn't for teenagers, and one of the things that is very important for a positive outcome is parents are involved in the treatment process. Most programs have a family or a parent component, so it's important that parents take that seriously and take advantage of that as much as possible. The other thing is, when parents are looking around for treatment options, let's say there's more than one program in town or nearby, and they might have some choices. There's some things to look for, or things to avoid if you don't see it. Number one is the program should have a specific adolescent treatment program, not one that's blended with adults. So you want to have a dedicated program staff for just working with adolescents. The space and the facility is separate from adults. It's an important consideration. Another one is to make sure that there's a reasonable amount of professionals on staff. You want to have a mix of psychologists, psychiatrists, chemical dependency counselors. Oftentimes the chemical dependency counselor is doing most of the therapy, but psychiatrists and psychologists often are needed to help with some of the specialized assessment and maybe specialized treatment for some of the difficult problems that often co-occur with drug abuse, such as ADHD, depression, anxiety disorders. The third thing is to ask about, so what is the plan for aftercare? How do you help your clients do well after formal treatment is done? Because as we know, this is not a kind of disorder that you can just get short-term treatment and things are going to be fixed 100% after the so-called treatment experience is done. And so good programs have a rigorous and a comprehensive and parent-involved aftercare program. So doing an assessment of the treatment approach and the treatment facility on all these features can help a parent realize, okay, I think this is a good program, or a program that doesn't have these features they might want to steer away from.
So what's a parent's role in treatment? What can they do to help their adolescent?
You know, one of the things that the treatment field has taught us is that continuing to be a very involved parent is a key to a teenager's health and well-being, including recovering from drugs or leading a drug-free lifestyle. Even when you have a teenager, even an older teenager, I think a lot of parents get discouraged and think that they're not having much of an influence. But I remind parents that isn't the case. They still have a strong influence. Now, it's true that peers perhaps are influencing more of their teenager's life than the parents are in the older teen years. There might be a relative shift. In the younger years, perhaps that isn't the case. But as youngsters are getting older, often peers are influencing more than the parent is. But it doesn't mean the parents are not still in the ballgame and still don't have an important role. They do. So that's a key. Just stay involved and continue to be a good parent. And being a good parent means staying connected, being good at communication, and staying on top of, as best you can, with monitoring and supervising the teenager's life, both at the home and outside the home. So that's one facet that is reinforced when parents are involved in treatment. Also, a lot of programs want parents to come to the treatment program and learn about the disorder of drug addiction, where they get educated on how it can unfold, what are some of the features that contribute to it, the importance of leading a drug-free lifestyle during the youth years, and all the problems that can occur when there's relapse, and how parents can be are important as a relapse prevention agent or helping with recovery.
So if a teen is having difficulties or having problems with using alcohol or drugs, how will that affect them as they get older?
You know, we're starting to learn more about this, and I think it's a stumbling block with a lot of health professionals and parents, realizing the importance of trying to get through the youth years drug-free. So one thing we know from data is that if one continues to use drugs during the teenage years, that increases the likelihood greatly that they'll have a drug problem as an adult. So it is true, some of us grow out of it. That's good news. But if you are using early in your teen years and continuing to use heavily, that greatly increases your risk of having a problem later in life, or having a very negative trajectory along those lines. There's also a new science building that's quite disconcerting, and that is that early drug use may also contribute to mental health problems that might not have emerged, or at least might have emerged at a much lower level if the drug use hadn't occurred in the teen years. So now there's this growing concern about not only drug use leading to risk for future addiction, but drug use in the teen years also contributing to onset of serious mental health problems, including psychosis, depression, anxiety. I'll mention a third one. This has to do with drug use and learning. There's some emerging evidence that's provocative. It's still early science. We can't draw strong causal connections yet, but it is suggesting that particularly heavy use of alcohol in the teen years can contribute to learning and memory problems. It just reinforces the importance of prevention as well as the importance of intervening when a teenager is starting to use and getting him or her to try to finish out the youth years drug-free. Teenagers can return to the issue of alcohol use when they're 21, when their brains are more developed and it's of legal age, and they can try to learn to drink moderately. That probably doesn't have the kind of health problems we're talking about when youngsters start to indulge heavily in alcohol and other drugs during those early years.
So what causes a teen to have problems with alcohol and drugs anyway?
You know, there's just probably so many causes, and scientists have come up with a long list, and some of them have to do with environment, home issues, parenting issues, how much drugs are available in a community, how much drugs are used by teenagers or peers that the teenager hangs around with. And then there's personality traits people have looked at. Is somebody have a problem more with impulsivity or not? And there's even biology that might be at play. Perhaps there's certain genetic factors that are contributing. But I tell parents, you don't want to try to worry too much or delve into what contributed or what caused, but the key is parents can have a significant role in the solution. Even if the cause is biological, something done in the home or something that parents can improve upon can help ameliorate the problem.
Is there anything else that parents or caregivers should know about adolescent substance problems?
You know, one thing that is emerging that I remind parents is that unwittingly, sometimes parents are contributing to the problem because the medication they might be using legally and under doctor's prescription in a healthy, safe way is unfortunately getting in the hands of parents. Particularly some of these drugs that are related to the relief of pain. And you know, sometimes these medicines are in the home, teenagers are getting access to them, and unfortunately they're getting out on the streets. It's a new emerging problem. Teenagers getting access to some of these heavy and very potent pain medications, OxyContin, Vicodin, etc. And parents just need to be careful. So if you're using medication, prescribed medication, don't believe that just because it's in the medicine chest and it's tucked away somewhere that your teenager won't think that it might have some role on the streets. And so you want to be very careful with that. Try to get it as secure as possible in the home.
Well, thank you very much for all the information and your advice.
Hey, thanks for the opportunity today.